Hi, I'm Dr. Bernadine Cruz, and I'm here right now with Dr. Wayne Berry, and I've just attended a marvelous seminar that you gave, and it answered a lot of questions that I've had and my clients oftentimes have when they come up with disc disease. So I myself have a bad disc in my neck, and the doctor said, there's no need, just, watch what you're doing, take it easy. How are dogs different than people with regard to disc disease?
Dr. Cruz, there are a number of factors, but one of the problems that we have is we tend to think that our dogs are just horizontal versions of us, but they're not. And it's particularly in the middle part of the back where we see issues with dogs. And certainly with you having a cervical or neck disc, if I was your physician, I'd be a lot more concerned about that than a lumbar disc, because in us, our spinal cords are so much shorter, and when our discs bulge at the bottom part of our spine, they're not going to put pressure on the spinal cord. They're unlikely to paralyze us. They certainly will make us very uncomfortable. And many of us have to endure different lifestyles because of our lumbar discs. But in the dog, where the degenerative process is different, and we tend to see a rupture of disc material into the spinal canal, it actually causes compression of the spine. And that's a hang of a lot more serious. But that is akin to what could be going on in your neck, is that if that deteriorates, if you start getting numbness to your fingers, which our patients aren't able to complain about, then you're going to need to have attention.
So when you typically see, I see a dog come in and maybe it's a little painful in the neck, maybe a little painful in the back. How is a veterinarian supposed to know, is this a pet that needs to go to surgery, or can I just support it with medication?
Now, that's a good question, and that's often a quandary, and not every single pet requires surgery. You as a veterinarian need to make a judgment call. You know your client. You know that there are going to be costs incurred with surgery. But the bottom line is to try and make as accurate a diagnosis as possible. Diagnosis of disc disease in dogs can be supported, although not confirmed, with x-rays. So we look at x-rays, we look at disc spaces, we see if there are changes to the bone. But invariably, just plain x-rays are not necessarily diagnostic. And so in many patients, we either have to color in the spinal cord, outline it with a dye called a myelogram, or we perform MRI. There are advantages and disadvantages to both of those procedures.
And not everyone has it available.
Exactly. And so, in the specialty hospitals where we do have the luxury of both procedures, in the smaller breed dogs, maybe because I'm older and more old-fashioned, but I prefer myelography because it is quicker, and particularly in dogs that I think are likely to have to go to surgery. The smaller breed dogs, where they are likely to have ruptured disc material, we do a myelogram, we confirm the diagnosis, talk to clients, and within 20 minutes, half an hour, we can have that patient in surgery and decompressed. In the larger breed dogs, many times we're going to prefer MRI, because they tend to be more chronic in nature, and the MRI has the advantage of evaluating in 3 different planes. We do numerous settings on the MRI, we compare before dye and then after dye. But it does allow us to do cross sections and longitudinal sections, horizontal sections. And particularly with lumbosacral disease, which would be akin to our lower back problems, the MRI is much more advantageous in that it allows us to evaluate that area of the spine that is not allowable to be evaluated with the myelogram, because the dye doesn't go down that far. And so the benefit of MRI is being able to do those types of studies and know whether there is nerve impingement or not.
If you've done these studies and you find, however you do the study, that there is a reason for surgery, what's the general prognosis? Because someone goes, boy, I don't want to put my pet through this if I know it's not going to walk later.
That's always a valid question, and it's the same question with diagnostics. As veterinarians, we've got to crystal ball so many of these cases and say, right, this is a worthwhile financial investment because we're going to get some really valuable information that is going to allow us to make more educated decisions. And so in some cases, medical treatment is preferable because we might feel that there are multiple compressions and surgery on one isn't necessarily going to help that patient. in which case we need to modulate pain, we control those signs, and we improve the patient's quality of life. But in cases where there is compression of the spinal cord, we need to remove that compression, and that requires a surgery. And so in cases where we are limited with funds, we try and do the best that we can by alleviating the patient's suffering and hopefully be able to prevent deterioration.
Well, Dr. Wayne Berry of the Southern California Veterinary Specialty Hospital, thank you very much. I think this is very enlightening. So if your pet is having some disc problems, seems to have a pain in its back, neck, or back, the best thing to do is always see your veterinarian, ask some good questions, and if necessary, see a specialist such as yourself. Thank you very much.
Thank you, Dr. Cruz.